This capacity building workshop is possible with the support of WaterAid UK and the Sanitation and Water for All organization through its catalytic grant support for the CSO Constituency to strengthen civil society, media, and NGOs' capacity to influence policies and legislative framework at local and national levels, promoting WASH rights for the most marginalized and vulnerable groups, that is the people with special needs, women, girls, young children, and the elderly in the country, and to assist YVE's goal in achieving effective coordination among WASH actors and contribute to the overall global WASH goal of improving the predictability, timeliness, and effectiveness of a comprehensive WASH response.
Basically, from the look, you realize that water and sanitation are very, very key in our life activity, which means water is life, as they normally call it. Without water, then there will be no life. And that applies to both humans and other living things, both trees and animals. So in that, it is important that the water that we use is quality enough for the public and also for other uses. So that also comes into an issue related to sanitation.
Climate change is the defining challenge of our time. This is now widespread consensus on the urgent need for action to be tackled the impact of climate change through well-targeted participation of efforts. At the global level, water cycle is directly affected by climate change. People's access to safe water, sanitation and hygiene solutions can be significantly affected by extreme events such as floods and droughts, as well as growing water scarcity. YEV, that is the Young Volunteers for the Environment-Gambia, and its partners recognizes the need for and the importance of issues that are creating such training opportunities for civil society organizations, the press, and also with other wide WASH active actors in the government and also part of the civil society organization, and to adapt to the challenges that they are facing.
Water, sanitation and hygiene, with the acronym WASH, is about management of water, it's about hygiene and sanitation in all aspects, so as to ensure that there is improved living conditions, there is adequate standard of living, which is guaranteed by international law. Unfortunately, in the Gambia, though, the right to water, the right to health is not guaranteed in the Constitution, but there are national institutions, national policies and strategies that have spoken to the issue of right to water or access to water in healthcare and sanitation and hygiene. The issue, though, is the fact that the availability of these services, the access, the affordability, and the quality of water and the services regarding hygiene and sanitation are very low, and partly because there are no maintenance of water treatment centers, for example, by NAWEC, but also because whether it's the government at the central or local level, there isn't much capacity, and more importantly, not much policy intervention.
I've been able to learn about WASH, that is water, sanitation and hygiene practices, and some of the core mandates that we have as local government authorities in the provision of these services. and the quality of the services, how to make them affordable, accessible, available, and quality service delivery. How well are we going to manage some of the water resources that we have in communities, and how well can we improve on them? It has been very interactive, and I've learned a lot in terms of climate change, resilience, and how well to plan, how well to engage communities to participate fully, not just involving them, but allowing them to participate, to take the lead in WAS and WRM processes.
I think it is going to help us at the soil solution level to really help us understand some of the synergies and the gaps that we need to inculcate in our work in order to help the people of the Gambia, especially the most marginalized people, the vulnerable people who are consuming water that is contaminated, the waters that are polluted. Really, we will be able to understand what are some of the guidelines in order to prevent these people from drinking these waters, and also what are some of the awareness that we need to the wordings that we need to give these people in order to build their awareness level to understand what are some of the precaution measures and also some of the guidelines measures that they can use in order to sanitize their water in order to drink healthy water.
It's in as much as we have rights as citizens of this country, we equally have a responsibility. This particular advocacy workshop is for the CSOs, to empower the CSOs and the media to come up with strategies as to how do we engage our governments, how do we put them to task, accountability, how do we hold them accountable. In as much as we want to hold our governments accountable, we equally have a responsibility. Every right goes with a responsibility. So information's coming up regarding our sanitation, regarding our hygiene, regarding our water is really shocking and is unacceptable. So it's a very good forum that I think and hope that the CSOs present here, the media practitioners present here, would take it up as an advocacy tool. It's unfortunate that so many activities are taking place in this country, but this is the first time I'm attending such a workshop where WAS is taken up 100%, and some of the issues affecting our lives and livelihood regarding to WAS is coming up.
As a journalist, we are always told you must be informed first before you can be able to inform the public, and I think this 2 days training has really exposed us to so many things that we didn't know. As far as the issue of water, sanitation and hygiene in the country is concerned, and this has really broadened our understanding as to how we should go about in doing stories relating to this very important subject matter, which is of course a fundamental human rights, but we have seen in many communities when you go there, what they complain is the issue of lack of potable, or should I say safe drinking water, which is a concern for so many communities. And this is something that as a journalist, I will take it upon myself to start to explore further as to what are some of the reasons as to why some of these communities are still without safe drinking water, and who is responsible as far as providing this fundamental human rights is concerned, and why is it not happening as we speak in the 21st century.
I'm a bit touched on this workshop to this past 2 days, because it makes me to be aware of many things as being a visual impaired. Like we are talking about water and sanitation. And water and sanitation is very important. In the Gambia nowadays, how things are going, everybody needs a clean water and a good sanitation. When you had the word called wash, wash it means it's a broad word which you know that every time you should be very careful of what you're drinking and your environment where you live. So it seems to be it's a very educative thing which you know that being a visual impaired, I should know what I'm doing and what I'm drinking.
Access to safe drinking water contributes to the general well-being of an individual as well as the family, and then it improves the overall economic status of the family or the individual. And then contributes also feeds into the overall productivity of the individual, and then this contributes to the society. So the importance of access to safe drinking water cannot be overemphasized.
The activities will help improve the process of understanding and overcoming the issues of policies in order to rebuild the people's lives rather than just physical development such as building houses, providing clean water or toilet. Our mission as members of the Sanitation and Water for All partnership is to eliminate inequalities in realizing the human rights to water and sanitation by raising political will, ensuring good governance, and helping to optimize financing. Our partnership focuses on the hardest to reach and most vulnerable individuals, communities, and regions, and put women and girls at the center, not just as passive recipients, but as dynamic agents of change.